Hello, my name is Cameron Torre, and I'll be presenting my group's project on the adoption of telemedicine. For the history of telemedicine, we decided to split it up into two parts, an early period and a modern era. For the early period, in the 1960s, NASA's Project Mercury started it all, demonstrated telemedicine potential by monitoring astronauts' health during space missions. In 1966, the National Library of Medicine's initiative laid the groundwork for telemedicine expansion in the United States. And in the 80s and 90s, specialized telemedicine programs began to evolve. Teleradiology enabled the remote interpretation of medical images, telepsychiatry provided mental health services in underserved areas, and telestroke programs allowed for remote consultation and treatment of stroke patients. For the modern period, we go ahead and start with the 2000s, the broadening of applications. Introduction of home telemedicine for chronic disease management, and the successful telehealth programs for veterans, which reduced hospital visits and costs. In the 2010s, legislative and policy changes happened. It expanded telemedicine coverage and reimbursement policies across various states, and the Interstate Medical License Compact promoted telemedicine practice across state lines. In the 2020s, telemedicine surged. Significant increase in telemedicine use due to social distancing and quarantine measures from the COVID-19 pandemic, and the rapid integration of telehealth services for non-essential appointments and remote patient monitoring. Current issues and root causes. For our current issues, we found that the regulatory and licensing barriers, controlled substance prescriptions, and patient and provider acceptance. For regulatory and licensing barriers, the issue is that the inconsistent telemedicine regulations and licensing requirements across states. The root cause of that is lack of a standardized national framework for telemedicine practice. Our second issue, controlled substance prescriptions. The issue is that doctors prescribing controlled substances via telehealth to patients who might not need them, and the root cause is the lack of proper regulations and monitoring for remote prescriptions, which leads to the potential abuse and misuse. Patient and provider acceptance. The issue is that hesitancy among patients and healthcare providers to fully adopt telemedicine, and the root cause is the lack of awareness, training, and perceived quality of telemedicine services. Solutions to regulatory and licensing barriers. The issue, inconsistent telemedicine regulations and licensing requirement across states. Our solution, create federal guidelines for telemedicine usage. A counter-argument to that, creating federal guidelines for telemedicine usage might undermine state autonomy, fail to address diverse healthcare needs, and overlook existing state-led solutions. For controlled substance prescriptions, the issue, doctors prescribing controlled substances via telehealth to patients who might not need them. Our solution is doctors should have to take courses on proper prescription protocols for telehealth patients. And counter-argument to that, while training doctors on proper prescription protocols for telehealth patients, it aims to address the issue of over-prescribing controlled substances. It may overstep on existing regulations and add delays in care. For patient and provider acceptance, the issue is that hesitancy among patients and healthcare providers to fully adopt telemedicine. Solution, institution of programs that educate patients and doctors on the benefits of telemedicine. And our counter-argument to that would be educational programs may not fully address deeper issues such as technological barriers, privacy and security concerns, and whether it is suitable for more complex medical cases. For our organization, we chose the Health Resources and Services Administration. Our background is that they are part of the Department of Health and Human Services. Our mission is to provide health care to patients who are economically underprivileged, isolated, or medically vulnerable. The HRSA aims to provide healthcare professionals to rural areas and train new healthcare professionals. For our chosen leader, we chose Captain Heather Demirez. The Office of the Advancement of Telehealth has supported numerous telehealth grant programs such as the Telehealth Broadband Pilot Program and the Telehealth Center of Excellence Grant Program. These both aim to improve telehealth infrastructure and demonstrate effective models of telehealth delivery. Interstate telehealth regulations licensing requirements helps to 1. Practice telemedicine across state lines, 2, facilitate the process for doctors to obtain licenses in multiple states. 3, telehealth resource centers provide resources and guidance to healthcare providers. And 4, help spread the best practices and regulatory information, which leads to standardization. Our chosen leader, negative traits. Lack of trust. Due to her success at a young age, some people might not feel Captain Demiris to combat this, so she could be a candidate about her age and experience. She could also do as Di suggests and actively welcome resistance among her team and then reassure them. Lack of emotional intelligence. Captain Demiris has a stressful job where it may be difficult to maintain her composure. She could maintain her physical and mental health to combat mental stress that might cause her to lash out. Last but not least, lack of integrity. Captain Demiris has a fair amount of power. It could be difficult for her to maintain integrity and resist abusing this power. To help this, she could write a personal code of ethics and make a strong commitment to stick to it. For our chosen leader, these are her skills. 1. Leadership. She oversees the development and implementation of telehealth programs and initiatives, strategic planning, resource allocation, and program evaluation to ensure the successful delivery of telehealth services. 2. Program development. She has created and managed multiple telehealth grant programs such as Substance Abuse Telehealth Network Grant Program and the Telebehavioral Health Network Grant. She has experience, background in public health nutrition, worked directly with patients as a dietitian, managed operations in various public health roles. And these are our references. Thank you.